and Ireland in sweeping travel restrictions from Europe. Plus, the president now recommending Americans not fly, even domestically. Also breaking tonight, President Trump saying today he has been tested for the virus and answering questions about his own temperature. Members of his cabinet now being monitored as well. The death toll from the virus rising in the U.S. as the number of cases here surges past 2,000. The rush tonight to get more Americans tested, with drive-through centers popping up around the country, and the new restrictions for nursing homes to protect the country's most vulnerable residents. Mounting concerns after the president and vice president announced Google was launching a coronavirus testing website, implying a large-scale operation. But the company now pushing back on those claims, saying the site is in its early stages, currently only rolling out in one state. The headline just in, Europe's new hot zone. Spain set to go on virtual lockdown as cases there spiked towards 6,000, more than 1,500 new cases in a single day, with the virus continuing to take a devastating toll on Italy. The big question tonight, are hospitals in the U.S. prepared to fight this global pandemic? The stunning admission from a doctor on the front lines. And the show must go on. The Broadway star recruiting young voices to help spread hope to a world on edge.
From ABC News, this is ABC World News Tonight.
And good evening. Thanks for joining us on this Saturday. I'm Tom Yamas. And we begin tonight with the many breaking developments in the worldwide coronavirus emergency. President Trump extending the travel ban with Europe, now including the UK and Ireland. The World Health Organization calling Europe the center of the pandemic. While here at home, New York State reporting its first fatalities. Drive-through testing getting underway there in north of New York City in New Rochelle. Catholic masses canceled throughout the Archdiocese of New York tomorrow. And President Trump surrounded by top advisors at the White House today, revealing he has taken the COVID-19 test and is awaiting results, saying his temperature check was, quote, totally normal. Shoppers continuing to stock up, emptying shelves in some stores like this New Jersey Walmart, and Apple stores around the world closing for now, except for China, which at first was the heart of the contagion. But Chinese officials now reporting a steep decline in cases. A lot to get to tonight, and ABC's Mona Kosar-Abdi starts us off.
Tonight, the Trump administration's 30-day European travel ban growing wider to include the UK and Ireland amid the coronavirus pandemic.
The president has made a decision to suspend all travel to the United Kingdom and Ireland effective midnight Monday night.
Vice President Mike Pence adding that American citizens and legal U.S. residents in countries affected by the ban will still be able to return home through 13 designated U.S. airports for screening.
But those Americans are being encouraged to return home and self-quarantine for 14 days.
The expansion of the 30-day restriction comes as COVID-19 has infected more than 1,100 in Britain and claimed more than 20 lives. And with major U.S. airlines cutting many flights to Europe, Americans like Scotty Orr have been rushing to return stateside.
And overall, it was just a very chaotic situation, but I am glad to be in my home in America now, safe.
Here in the U.S., airlines like United, Delta, and American also cutting domestic flights due to a decline in demand. President Trump today with a stunning statement telling Americans to only travel domestically if necessary.
Well, if you don't have to travel, I wouldn't do it. If you don't have to travel, we want this thing to end.
All right, Mona joining us now live from Reagan National Airport in Washington. The TSA now relaxing one of those 9/11 era travel restrictions, where people are traveling with hand sanitizer.
That's right, Tom. The TSA, at least temporarily, is allowing travelers to take up to 12 ounces of hand sanitizer with them through airport security. Tom?
All right, Mona Kosar-Abdi leading us off tonight. Mona, thank you. After days of saying he didn't need a test despite potential exposure, today President Trump revealed he has been tested and is awaiting his results. After he declared that national emergency, the House voting overnight to approve a massive aid bill providing enhanced unemployment benefits and free virus testing, with the Senate taking it up on Monday. ABC's Trevor Ault with more on precautions tonight at the White House.
Today, President Trump stepping before the podium to tell the American people he's been tested for the novel coronavirus.
I decided I should, based on the press conference yesterday. People were asking, did I take the test? I don't know, whatever it takes, a day or 2 days, whatever it is. They send it to a lab.
For days, the president had been saying he didn't need one, even after concerns he'd been personally exposed to the virus.
I don't think it's a big deal. I would do it. I don't feel that any reason. I feel extremely good. Let's put it this way. I'm not concerned.
Are you being selfish by not getting tested and potentially
Well, I didn't say I
exposing-
wasn't going to be tested.
Are you going to be?
Most likely, yeah.
Overnight, his personal physician releasing a letter saying a test for the virus was not currently indicated, as he said the president was low risk, despite coming into contact with several Brazilian officials who have since tested positive, including communications chief Fabio Weingarten, seen here next to the president. The Brazilian delegation also met with Miami Mayor Francis Suarez, and he too is now infected, and Brazil's president Jair Bolsonaro will be tested for the virus for a second time on Friday.
Thank you very much.
With officials urging social distancing, the president's also drawing criticism for seemingly disregarding advice from his own agencies, shaking hand after hand Friday in the Rose Garden.
But why are you shaking hands, sir?
Because it almost becomes a habit. People come up to me. They shake hands. They put their hand out. It's sort of a natural reflex. Shaking hands is not a great thing to be doing right now. I agree.
Today, the White House unveiling new measures to limit the threat of exposure inside the West Wing.
You should space somewhere.
Members of the media getting their temperatures taken before entering the briefing room. The vice president's office saying one journalist was denied entry because his temperature was too high. When asked if the coronavirus task force assembled at the same podium as the president and vice president were also being checked, they all nodded.
I had my temperature checked too.
Even the president telling us as he left the room.
Was your temperature normal, Mr. President?
Totally normal.
All right, Trevor Ault joins us now from the White House. And Trevor, you were in the brief room there, and the vice president said he had not been tested for the virus. This is the second time in 2 days he and the president have appeared next to each other. What's being done? Are they ignoring those social distancing recommendations?
Well, Tom, ABC News has obtained an email sent by Vice President Pence this afternoon to the entire White House staff, urging them to avoid physical contact. It says the CDC recommends home quarantine for anyone who's had prolonged exposure, but it does specifically say that doesn't apply to handshakes and photographs. And Tom, President Trump says it will still likely be a day or two more before he gets his test results back. Tom.
All right, Trevor Ault with all those new developments from the White House tonight. Trevor, thank you. Next to the scramble for information and testing for the sick, so many people taking officials' warning seriously and hunkering down now at home, hoping to stop the spiral of cases. New York State reporting its first 2 fatalities. Here's ABC's Diane Macedo.
Tonight, New York is reporting its first 2 coronavirus deaths as COVID-19 spreads across the country. Mayor Bill de Blasio confirms an 82-year-old woman died after being admitted to the hospital last week in critical condition. She was also battling advanced emphysema. It's unknown how she got COVID-19. And another 65-year-old victim with underlying health issues died in Rockland County.
We're going into a full crisis footing. This is a wartime dynamic.
New York State is now reporting the most cases in the country, 524.
This is a virus that does not threaten all segments of our society equally.
This map shows what nationwide cases looked like just 2 weeks ago. At the time, the virus was confirmed in just 9 states, and the first death had just been announced in Washington. Tonight, 49 states are confirming cases, plus the District of Columbia, with more than 50 deaths nationwide. West Virginia is now the only state with no reported cases of COVID-19. The common complaint? Lack of thorough testing.
We don't feel like we have enough tests. I don't think anybody feels like they have enough tests right now.
Local governments are trying to catch up with drive-through testing sites in San Francisco, Seattle, Denver, Birmingham, all the way to New Rochelle, New York, where residents with symptoms have to call a hotline to schedule a test. Each city has a different protocol. Meanwhile, the president is promising a website to help streamline the testing process. But tonight, questions are mounting about that. This is nationwide. At least 46,000 schools have closed, keeping some 26 million students at home. For the first time ever, Apple is closing all of its stores worldwide, with the exception of China, for 2 weeks. And tonight, retailers say they're working with suppliers to keep up with heavy demand for cleaning supplies, toilet paper, and hand sanitizer.
We're still replenishing it and shipping it, but as soon as it hits the stores, it's going.
All right, Diane Macedo joins us now live from Times Square. And Diane, we are just getting some breaking news in, as you were reporting there, about an outbreak not too far from Times Square in nearby New Jersey.
That's right, Tom. Teaneck, New Jersey is reporting 18 cases. The mayor there is now asking people to quarantine there and not leave their homes unless absolute needs necessary. He says he believes people may have been walking around with cases for 4 weeks now. So again, Teaneck, New Jersey, asking residents there to self-quarantine, using the language that this is now ground zero for this virus. Tom?
Diane Macedo with that breaking news just in tonight. All right, Diane, thank you. Next to the president's claim that Google is launching a coronavirus testing website. But tonight, the reality check. Here's ABC's Rachel Scott.
Tonight, mounting questions about the program the president promised the American people.
It's going to be very quickly done, unlike websites of the past, to determine whether a test is warranted and to facilitate testing at a nearby convenient location.
Touting Google's work on a website with easy access to coronavirus testing information.
Google has 1,700 engineers working on this right now. They've made tremendous progress.
And it wasn't just the president. Dr. Deborah Birx of his coronavirus task force holding up this chart to explain how it would work.
Where clients and patients and people of interest can go, fill out a screening questionnaire.
The vice president jumping in too.
And then at the same website, you'll be directed to one of these incredible companies that are going to give a little bit of their parking lot so that people can come by and do a drive-by test.
But about a half hour after the president's event concluded, Google tweeting this statement on behalf of their sister company, Verily. Their website, as of right now, is in the early stages of development, and that it plans to roll testing out in the Bay Area with the hope of expanding more broadly over time. Today, the vice president was pressed for an explanation.
So where's the discrepancy about the website, Google's involvement?
We're working literally around the clock. And I know that our whole team working on this public and private partnership couldn't be more grateful to all of the hardworking people at Google that are helping to put this website together. But tomorrow, 5 o'clock, we'll have very specific, description tomorrow.
All right, Rachel Scott joins us now from Washington. And Rachel, the vice president, when asked, repeated that more information about this website will be announced tomorrow at 5 p.m.
Exactly, Tom. But again, the website says that it's in early stages of development, at least according to the company behind it. Now, Vice President Mike Pence said that there were plans to launch a version of this site in the Northern California area on Monday. But as for a more detailed timeline of a possible national rollout, he says that will come tomorrow evening. Tom?
All right, Rachel, thank you. In this programming note, tomorrow morning on This Week, John Carl goes one-on-one with infectious disease expert Dr. Anthony Fauci and Treasury Secretary Steve Mnuchin. And overseas to Europe now, where cases of COVID-19 have been so rapidly expanding. The major announcement today from Spain, heavy restrictions on movement for 46 million people, effective immediately, plus new measures in France, Germany, and of course, hard-hit Italy. Millions staying home in hopes of riding this out. Here's ABC's Julia McFarland.
Tonight, a new hot zone in Europe. Spain announcing a nationwide lockdown after already declaring a state of emergency. Authorities saying any movement by residents needs to be justified. They're only allowed to leave their homes under limited circumstances to do things like buy food or go to the pharmacy or the hospital. More than 5,700 infected with COVID-19 there already. Fears that number could soon reach 10,000. In just a few weeks, the outbreak's epicenter swinging from China to Europe with devastating effect. In Italy alone, COVID-19 claiming 175 lives in the last 24 hours. North of Milan, this Bergamo newspaper's Friday obituary section larger than normal, 10 pages long. In Rome, lockdown residents gathering on their balconies, applauding the efforts of medical workers. More than 500 people recovering from the virus across the country in the last day. And in France, the Prime Minister announcing that non-essential public places will be closed, including restaurants, cafes and cinemas, until further notice.
And those strict restrictions in France now being replicated in Germany, Julia?
Exactly, Tom. Tonight, the Berlin Senate deciding to ban all events and public gatherings of 50 people or more. Bars, casinos, cinemas, museums, concerts, and similar businesses, they're all going to be closed to the public. Restaurants may stay open, but only if their tables are at least 1.5 meters apart. They're serious about stopping this virus in its tracks. Tom?
Julia McFarland from London tonight. Julia, thank you. Next, back here at home to a focal point of so many concerns. Tonight, elderly Americans, especially those living in nursing homes, the stark measures to keep them safe, and the big worries tonight. Here's ABC's Marcy Gonzalez.
Tonight in that Washington State nursing home where more than 24 residents have already died amid the coronavirus crisis, several people are still waiting for test results. Families on edge as the National Coronavirus Task Force announces new measures to protect the elderly in facilities across the country.
Nursing homes should restrict all visitors effective immediately, and that includes all non-essential personnel. There are some exceptions for end of life.
In addition to that visitation ban, all group activities, including communal dining at nursing homes, now canceled, and healthcare workers are now being actively screened. Actions Charlie Campbell hopes will help other patients like his father, Eugene. The 89-year-old was among the residents who contracted COVID-19 at the Life Care Center in Kirkland, Washington.
We figured because of his age that it was pretty much a death sentence.
But a week and a half later, he's showing positive signs of recovery.
I think there's a pretty good chance that he'll survive it. Doctors are cautiously optimistic.
And today, the nation's top infection specialist, Dr. Anthony Fauci, offering some optimism for healthy seniors, stressing that without any underlying conditions, the risk of infection is significantly less. Tom?
Marcy Gonzalez for us tonight. Marcy, thank you. And be sure to tune into our ABC News special on Monday night, 2020 pandemic, what you need to know, beginning right here at 10 o'clock Eastern. And there is much more ahead of World News Tonight this Saturday, answering your questions about the coronavirus. Are U.S. hospitals overwhelmed? We talked to a doctor on the front lines. Plus, stunning images after an apparent tornado wipes out an RV park. An update on the injured. Rising tensions in Iraq, a base housing U.S. troops attacked for the second time in days. The warning tonight from the Pentagon. And the online casting call going viral. The young performers impacted by the coronavirus spreading songs of hope.
This is ABC World News Tonight, sponsored by AstraZeneca.
Hi, I'm Bob Harper, and I recently had a heart attack. It changed my life, but I'm a survivor. After my heart attack, my doctor prescribed Brilinta. It's for people who have been hospitalized for a heart attack.
Brilinta is taken with a low-dose aspirin, no more than 100 milligrams, as it affects how well Brilinta works. Brilinta helps keep platelets from sticking together and forming a clot. In a clinical study, Brilinta worked better than Plavix.
Brilinta reduced the chance of having another heart attack or dying from one.
Don't stop taking Brilinta without talking to your doctor, since stopping it too soon increases your risk of clots in your stent, heart attack, stroke, and even death. Brilinta may cause bruising or bleeding more easily, or serious, sometimes fatal bleeding. Don't take Brilinta if you have bleeding, like stomach ulcers, a history of bleeding in the brain, or severe liver problems. Slow heart rhythm has been reported. Tell your doctor about bleeding, new or unexpected shortness of breath, any planned surgery, and all medicines you take.
If you recently had a heart attack, ask your doctor if Brilinta is right for you. My heart is worth Brilinta.
If you can't afford your medication, AstraZeneca may be able to help.